All right, everyone, let's just recontinue. In our previous lot, we were talking about the assessments required in case of evaluation for the client or the child with the autism spectrum disorder. In case of any kind of neurodevelopmental disorder, our diagnosis is a very sensitive and very keen matter because that particular diagnosis, that particular assessment will stay with that person throughout his life. All right. So the we were talking about the multidisciplinary reports, as we have talked about the reasons behind that include the genetics and the neurology itself, or the prenatal and perinatal obstetrics evaluation. Then we had talked about the diagnostic assessment that should be approved by the psychologist, because the particular assessment is only authorized to the psychologist to be assessed with. That include the Wineland Adaptive Behavior Scale, VABS-3. CARS is a particular diagnostic tool for the autism disorder. Then here comes the intellectual assessment. That includes basically a variety of tests, as we have talked in our previous class regarding the intellectual disability. So that will depend on the child age and certain demographics. If the child is not able enough due to the language impairment, then you have to mention it in the accompanying features or the specifiers when diagnosing the autism. All right. Then comes to the next thing, that is the spectrum around the autism. As we have talked, that autism itself is basically a huge continent to be covered. So associated disorders include this particular list, that is the intellectual disability. Every children or every group of children with the autism spectrum disorder, four or actually the 3 out of 4 have intellectual disability comorbid with the autism. Then here comes the learning disabilities. In case of epilepsy, here has been mentioned that according to the researchers, every 4 of the children with the autism, one have epilepsy alongside. All right. Then comes the tic disorder, sleep disorders, psychiatric. So the reason behind that is basically right. So the reason behind that has been shared with you guys, that as the psychiatric condition would develop in the later ages. So here comes the differential diagnosis. When you are talking about the diagnosis of autism with any client, then you have to make sure that you have eliminated these particular possibilities when diagnosing the individual. That would include ADHD, ID without autism, language disorders, particularly social communication disorders, selective mutism. As we have talked about the clients, they would have a very limited interaction, very limited social communication. All right, we have talked about their eye contact, we have talked about their relationships, we have talked about that they won't be able enough to get comfortable with anyone. So might be that particular presentation and the selective mutism can coincide. So to differentiate that, you have to be very sensitive towards the differential diagnosis. Then here comes this particularly stereotypic movement disorder. All right. In case of stereotypic movement disorder, only that particular criteria of the stereotypic movements or preoccupied or repetitive patterns of behavior would be included. Other than that, the autism won't be reliable in that particular person. All right. Then comes the anxiety disorders and schizophrenia or personality disorder in the very adults. All right. And you have to differentiate that. We have talked about what is autism. We have talked about its spectrum. We have talked about the specifiers. We have talked about the DSM itself. We have learned about the causes and the relativity of the autism. We have learned a lot about, right? Now we would be moving toward the treatment management in case of autism. First of all, here comes the psychopharmacology, right? In case of autism, those are the particular, you can say the medicational groups that can be revolutionized for the autism itself. All right, that include the stimulant medications that would only be prescribed if that particular patient have deficit. All right, in case of obviously the social communication and interaction, as well as that particular child have very restricted patterns of behaviors or interest, or you can say have a very you can say a deficit sensory or unusual sensory gestures, then we would be able enough to move towards the stimulant medications as per the prescription by the psychiatrist. Then comes the selective serotonin reuptake inhibitors, atypical neuroleptics, then mood stabilizers, atypical antipsychotics. I have differentiated the atypical antipsychotics from the neuroleptics. The basic reason is basically the most commonly risperidone and aripiprazole are the two medications of the atypical antipsychotics that have been prescribed to the patients of autism. Then comes to what basically being a clinical psychologist we have to do. All right, these are the particular activities or programs we offer for the clients with the autism, that include the educational support. There are certain schools, certain educational grounds for the children with the special needs. All right, then come the tech. That is a particular program only developed for the children with autism and its relative disorders or the problem. All right, and that is basically a individualized educational training program for them. All right, then comes the applied behavioral analysis. That would only be used when they are lacking particular behaviors, as like we have talked about their preoccupation with certain toys, certain colors. All right, they're lacking in particular behavior, then we can work on that with the applied behavior analysis. All right, then comes the developmental individual difference relationship based model. Developmental individual, in case of early children, all right, like at the age of 3, 4, 5, 6, 7, then it's this program is very good for them, because that will help them to develop different relationships. All right, then comes the relationship development intervention. It is bit same like the developmental individual difference relationship program, but it's basically have a very revolutionized model. Then comes the classroom based program. As we have talked about the educational support, it's basically like that, where the clinical psychologists basically work in that particular institute, and they work in the group environment with that particular individuals, and they engage them in particular activities and made them learn about it in a very strong manner. All right, then comes the pragmatic language and social training program. That is very good for the individuals lacking a particular language, or you can say collectivity of the language, as like the individual with a level 3, or we can say they're requiring a very much substantial support. Those children are basically prescribed with this particular training program. All right, we have talked about autism in a very detail, but let me tell you, autism itself is basically a hidden disability, because it's not easy to actually recognize someone having that particular condition. All right, but universally, if you see someone with this particular band, with this particular colorful band, I hope this is very much visible for you guys. You have to understand, being a professional, that that particular person is having a condition of autism spectrum disorder, and that particular person needs your support. All right, that is a universal brand, or you can say a universal token for them to be understood by others. All right, autistic people obviously have very often difficulty in accessing the community activities, their layer facilities and other services, because we guys basically have a very tantramatic communication, where we impose a verbal, non-verbal, or empathetic and non-empathetic as well sometimes. So they're not able enough to understand that particular complex bunch of communication at the same time. All right, with the expressions, emotions, or um, tone, or verbs, that all that. So basically, that is the reason they are not able enough to indulge in particular community activities. but everyone having a better understanding of autism, I hope that would be very much helpful to power to change the child, or especially the individual's life who are having the autism. All right. So be aware of the autism and its differences, and ask the autistic person and their caregivers or their seek advice from the others. You can ask them very politely if they need anything. Are the particular people are very understandable towards you? Do you need some kind of help to understand them? All right. You have to be very simple in the communication with them. As like I am not using my IELTS English here. I'm using a very simple verbal English right now to make you guys understand each and every word very carefully. All right. So you have to make sure of that. All right. Being understanding, people with autism have a lot to offer, but they require certain support. And if we are able enough to provide that support, trust me, they can work very well as compared to us. They can work just like us, but that requires certain support. Just like we can decrease the noisy environment, we can use LED lights as compared to those flashlights in our rooms. All right, prefer a quiet space. Use a very gastral, or you can say a very expressive and very calm tone when talking to them. All right, adapt your communication. I think being a professional, I would say that for everyone, it's very good for us to adapt our communications now. All right. The reason is we are, no doubt, we have been working in a very developing era, in a very technological era. But according to me, we have to work on our communication because we are getting robotic in our communication or interactions. All right. You have to speak slow and clearly, allow the time for the person to understand, to process your information. All right. You have to avoid your gestures, your facial expressions, uh, very overcoming facial expressions towards them. All right. You just don't use any kind of idioms or metaphors towards them. Use a very calm, very simple, schooling English towards them, and that will be very great for them to understand you, and they would be very much able enough to adapt your communication. All right. So these are the few things I wanted to make sure you guys learn about. Now, as like in the previous lecture, some of the students requested that I should share some practical, or you can say the some case reports from the daily life I have been working on. These are the few cases I would like to make you guys understand. That is basically case of almost 4.5-year-old female, and the presenting complaints were, it's been in Urdu, but let me translate that for the students who are from the English curriculum. That is, she doesn't like change, and she got irritable when there is a particular change in her surrounding. The second one is she doesn't like and she is not able enough to speak full words, or the phrases, and the parents perceive that she is a bit lacking in the milestones as compared to the peers. The fourth one is she doesn't make eye contact, and she doesn't even respond to her name sometimes. Then comes yes, the same thing. Then comes she just has been preoccupied with her toys, and she just want to make sure that she is playing alone. All right, that is the fixated interest in case of autism. All right, she doesn't like to go anywhere because of the afraid, because of being terrified by the change, by the new social interaction, by the people. So for the assessment, we used obviously the basic, that is the clinical interview. Then we moved forward for the Vineland Adaptive Behavior Scale, because the child was over the age of 4 years, and she was being in the school environment. So we had to make sure to basically work on her behavior. And Vineland Adaptive Behavior Scale does not actually require, in case of its comprehensive form, that does not basically require interaction or the questions from the patient. You can actually work on that by using certain techniques, all right? By using certain tricks, certain activities, you can access that particular person. Then we use a diagnostic tool, that is the Child Autism Rating Scale cards, as we have mentioned in the treatment recommendation and assessment. So here it comes. If I have to talk about it, I would suggest you guys shouldn't go through all the case report, because it won't be very much comfortable for you people. But all right, let me see if we have. No, we don't have that. uh Unfortunately. All right, so if I have to talk about her, I would say that particular children was actually having a problem that she would snatch things from others. She was unable to speak certain words. She started feeding late, according to her mother. Her that milestone was delayed. She started walking at the age of 2 years. That is obviously a very much delayed. She had a behavior of thumb sucking, hair rooting while sleeping. All right, she would just eat her hair or her mother's hair when she was sleeping. She was very hyperactive, and that is the reason I wasn't able enough to go through the whole intellectual battery. She had a very irritable behavior towards the change of environment, even in case if I had to change the room when talking to her, or when having a session with her. She had a very anxious mood all the time, had a very stubborn behavior, can't look into the eyes while talking, all right? Don't respond when calling her name most of the time, and have a very fixation interest over the period of time. So basically, we had to make a tentative diagnosis for the autism, but for the confirmed diagnosis, I preferred global developmental delay requiring support on persistent basis. As I had talked earlier, in case of autism, you have to be sure if the client or the patient is having an accompanying condition of intellectual disability or either the language impairment. You have to mention that. All right. But as we have understood that her age was 4.5 years, not the 5 years, then I have to make sure the criteria for the DSM-5, that was her age should be above the 5 years in case of ID. So I had to make her diagnosis as a global developmental delay, so that over the period of time, she should be reassessed after the 5 to 7 months to get that particular diagnosis. All right. So in case of recommendation for her, that was the short-term goals. If you want to read it out, you guys can read it out. Those were the certain techniques we had worked on, including the positive reinforcement, socialization training programs, all right, parents training program, and overall, we had worked with her with the play therapy using the behavioral modifications, including the conditional positive reinforcement, tunnel technique. That is the particular technique used for the eye contact and the verbal communication initiation in case of autism. That is a very good and very common technique practiced in case of autism. Then come the prompt for the vocabulary. Basically, her speech was very much delayed and she had a very limited speech. So I had to make sure to work as a speech therapist at that particular time as well. All right, then comes the mirror talk play for eye contact and language. Basically, in that particular technique, you have to make sure the child is standing in front of the mirror, and you would like when we are playing with our children at home, and we make sure that we are playing with her in case of mirror, and we would just put them on the dressing table, and we would be like playing with them, and he would be looking in his reflection in the mirror, and child will be laughing and glaring at that um at their shadow or at their reflection. That is a particular that kind of technique. Then comes to the group play therapy and educational training program, parental training as well. So these were the basic techniques that had been used to her over the period of time. And if you guys want to capture it, you can for sure. These were some techniques I had to develop on my own. That was the individualized educational training program in psychology. Particularly for such patients, you can develop an instant intervention, or you can say an instant training at that particular time, just for the learning purpose of that client. All right. I hope you have understood that. That is basically the log form for every client. Then here comes another case. All right. Here, I hope it's very much visible for the people who are from the Urdu grounds, but let me translate it for the people from the English background. All right. Child is very much aggressive, doesn't like speak and doesn't speak at all, is very irritable and stubborn. If in case his actions are not being very profound, then he would just throw the tantrums and throw the things apart. All right. And eat soil very much. All right. Child age is around 3.7 years. In case of diagnosis of the autism, as we have talked earlier, the age should be above the year 4. All right. So here, the client age is 3.7 years. All right. A lot of people would ask, and my students often ask me, why in certain practices a portage guide for the early education has been using. That is the portage guide, right? So the reason behind that, oftenly, the minor and adaptive behavior scales or some scales like that are not being so accessible for the school communities or the special education communities or hospitals, because they have to purchase the manual. So in case if they don't have that, they compromise on the portage guide to assess the client's behaviors just for the sake of time. All right. So um, here are the lackings and her prophecies around that particular subgroups. Here you can see the self-help skill is 37.7 months, all right? And the cognitive is 6.5 months, all right? So you can see he is lacking far apart than as compared to the age group, all right? That is the treatment planning for that particular child. We had used psychoeducation for the parents to understand what basically autism is and how they can work on that. A concept formation for them, um, tunnel technique, play therapy, parental counseling to improve the social skill. You can work with the different techniques such as the group handshakes and flying goodbyes. You have to obviously give them certain prompts for that. All right. Practice sharing, hide and seek behaviors. All right. That is a game we used to play in our childhood, but that is actually an intervention in the case of play therapy with the children. To improve his motor skills, we used to work by the scribblings, by folding papers, turn and down, and then add the quadratlets. All right, then comes the stringing the beads. All right, then comes the scoop with the spoon. All right, that is the basic activities you can carry out with the children in case of autism. All right. So that was the lecture of the day. If you guys have any question, you can mention me in my YouTube channel. That is the Science of Psychology. And you can ask me the question there. Lectures will be uploaded there and you can just take the lectures later. All right. Have a good time and remember me in your prayers. Stay blessed. Thank you. Allah Hafiz.